Hi, video number 2. I was excited to go ahead and do this one. I have some updates and some information on how they do the casting for the LSO brace and stuff about the pre-op testing and another class that I took today. The casting, I had no idea what it was going to be like. I did research on the computer looking, how do they make an LSO brace? How do they do this? How do they do that? And um, when I went to do the casting, which is what it sounds like, I'm going for the movies. When they were doing the casting, I asked the guy, could you please take photos of me? And I always have a camera around, and I have no problem with myself looking silly or funny. Um, but I wanted to take these pictures. They're decent. You can't see anything in them. They're embarrassing because you can see my size, and there are some rolls, if you would mind saying. Um, so if you don't have anything nice to say, please don't say anything at all. This video is for people who was like me, looking for information, and if I had found a video like this when I was looking for information, I think it would have made me feel a lot better than just kind of going in and like, okay, I don't know what comes next. So that's what this video is for. Um, so enjoy the pictures. They're not the prettiest, but maybe it'll help somebody. That aside, first thing they did when I got there, paperwork, of course. And then the guy took me back into the room, asked me some questions, and then he had, it was like a skin tight mini dress almost, but it wasn't anything special. It was just like some, not netting, not tubing, it was cloth, okay, in a tubular fashion. I'm not good at describing things. And it looks small, but it stretches. And he doubled it over and he cut out armholes. And then he said, I'm going to step out of the room, you put this on. So you put it on, and it's pretty tight. You kind of like have to wiggle into it and everything. He comes in, he gets the bottom layer, straightens them and stretches it out, makes sure that there's no wrinkles. He takes the top layer and stretches it down, about like by your thighs and around your body. Make sure everything's really, really tight. There's a picture of a wire, not a wire, I'm sorry, a rubber, like tubular type thing. And that he put between the first layer and the second layer. So he put it in between. I didn't know what it was for, and I didn't ask, but I found out. So then when they go to do the wrapping, you kind of stand there with your arms out. And mine was my lower back. So he started, right under the bra line, just right there, and went a little bit, um, I don't know, I guess your pubic bone, pubic area went down there. Um, he had a bucket of water. It wasn't, it was warm. Uh, he had like this, it was like an ace wrap type thing, but it was more of like a harder, formable type thing. He soaked it in the water, and then he starts to, go around you. And then as soon as that one stops, he holds it down, starts another one, and he goes around and around and around and around and around and around. Once it's there, you have to stand, you can't bend or anything. You have to kind of stand there pretty still. And, they'll smooth out the edges, like where your waist is. He kind of like put his hands in, like, where's my, here, put his kind of hands in like this, and make the little indentions for just for, like your body, so it molds to your exact body. And they sit there and they rub on you for a hot second, and it's kind of weird, but I guess that's their job. And they get it all situated. Only took about 8-9 minutes, and he said, okay, we're gonna cut it off. There's a picture of the circular saw, I don't know what you want to call it, that they used to cut it off. And that's where that rubber strip came in, because he cut along where that rubber strip is, and you'll be able to see it in the side view. The strip goes down like under my arm. That way he didn't cut me with the saw, he just went right along that, so that was pretty cool. um, I will get the brace and do my final fitting next Wednesday, so 8 days, the day before surgery, so I hope it fits. um, I'll show you what it looks like when I get it. But it wasn't as bad as I thought. They were really modest. They were fine. They, took the brace off, cut it off, and, so now they're going to go do the molding. I had, it wasn't bad. It wasn't bad at all. So I'll show you these pictures, and then I'll tell you about the pre-op testing. All right, the pre-op testing. If you've ever been to the doctor's office, that's about the extent of it. You go in there, you wait in the waiting room, you sign in. They go through like a registration process. They ask you a bunch of questions. They get copies of like, if you had like a DNR or the Do Not Resuscitate, advanced directives, living will, things like that, insurance card, blah blah blah. Go into the room. Doctor comes in, says, I'm just here to clear you, make sure that you don't need to see anybody else, or that there isn't any special things that need to be done for anesthesia or surgery. Asks you just a little bit about your background. Nurse comes in and does a set of vital signs, blood pressure, pulse, all that stuff. Um, back to the doctor. He did for me. Listen to your lungs and make sure that your lungs sound fine, and listen to my heart. And that's about all he did. But anyway, uh, and then they did do blood work, and they drew some blood. They did about 4 of those like little vials um, of things. They did a nasal culture to see if like I have like staph or an MRSA, if I'm a carrier for it, which I believe I am. And it's a nasal swab, and it was the funniest thing. She took it out, and it's like 2 Q-tips. And she's like, okay, I'm just gonna get the swab here, both at the same time, and I'm just sitting there like, oh, it tickled, didn't smell bad, so that was that. That was kind of funny. And then pee in a jar or pee in a cup, and then they do whatever they do with that, whatever testing they need, and it's pretty fast, pretty simple. Oh, they give you some special soap. It's like a Hibiclens soap. Antibacterial and antimicrobial. It's a really good soap because I have had staph infections before in the past, and this soap, I mean, kills it. Like, it's awesome. So she gave you some of that soap, or gave me some of that soap, with the directions of, wash the night before surgery and the day of surgery, with your regular soap and everything, and then again with this soap in the areas of the surgical site. So that was kind of cool. And then that was the pre-op testing. Simple as like a doctor's office. And then I went to another class at Christ Hospital, and I just want to say that Christ Hospital is amazing. Like, I've always dealt with St. Elizabeth, and nothing against St. Elizabeth. I'm sure that they have their own little niche that they're good at. But St. Elizabeth, or Christ Hospital, was, oh my goodness, amazing. They go over this class. They talk about, I mean, details down to what socks they're going to put on you after surgery, what bed you're going to use, how you're going to roll over. I mean, they talk about everything. They make you feel really comfortable. Uh, my cat's trying to climb up here. Okay, all right. There's your 5 seconds of fame. Um, but it was really good. And I'm sorry. Yeah, so pretty easy day. They didn't the testing, or I mean the class at Christ. They didn't really go in too much about the surgery because I had that class through the surgeon. Um, they just did more of hospital type stuff. But still, it was very good, and I enjoyed it. So I don't think I really have any more pictures for today. I think this is going to be about the end of video number 2. Try to keep these things semi-short. kind of update you, and I hope that this video and the series of videos to come and the one video I have before this helps somebody, because dude, if I saw this video I would feel a lot better knowing, like, okay, so that's how they do the casting, and when I go in there I'd be like, oh yeah, okay, so I don't know, I hope it helps somebody, and that, I guess, will be the end of video number 2. Thanks.